Today we'll talk about supraventricular tachycardia. So supra means way more than it should be, or above. So in this case, it's above. Supraventricular is above the ventricle. So here we have the ventricle. So it's supraventricular. So it's going to be on the AV node or above the AV node. And tachycardia is a dysrhythmia, or actually it's just like an irregular type of beat, which is not a type of beat. It's just when your heartbeat is more than 100 beats per minute when you're at rest. And that is not like too bad. It is bad, but it's not too bad. All right, so supraventricular means above the AV node or at the AV node, and tachycardia means more than 100 beats per minute at rest. And so we have heart rate over 100 beats per minute when, for example, doing exercise or when we are in fear, aka adrenaline. But when we are rest, we are between 50 to 80 beats per minute. But these people that have tachycardia, supraventricular tachycardia, they have more than 100 beats per minute at rest. And so some are asymptomatics, but the symptoms are dizzy, anxiety, palpitation, short of breath, and chest pain. And people feel dizzy, but it's very rare for people to pass out. And they feel dizzy and shortness of breath because there's not enough time to feel the whole ventricle. So it's less blood. All right, so the diagnosis, they will make an EKG. Normal, but tachycardia is like it can disappear in a moment's notice and come back in a moment's notice. So you might have tachycardia going to the doctor's place, but when you get there, you don't have tachycardia. It can happen. And knowing that, they give you a portable EKG, so you take it home, and if it comes back, it will notificate. It will tell the doc that you have tachycardia. And this is supposed to be a normal EKG. If you have 100 beats per minute, it's going to be like that all over the place. Like, it's going to be crazy. And there are many types of tachycardia. This is one, the supraventricular. So there are many risk factors, but you can have COPD, which is chronic pulmonary disease. Chronic obstructive pulmonary disease is when you have like an embolus on your pulmon on your lung. You have an edema, which is an inflammation. Also, you can have inherited conditions, structural abnormalities, because your heart is pumping, so it can evolve and end up in a abnormality. You can have coronary artery disease when you have fat stored up on your veins, the coronary arteries in this case, or because you've had heart failure previous to this. Also, alcohol abuse, hyperthyroidism, and if you had too many medications, that can happen. Specific medications, not any medications. Yeah, so that's it.